Hello, Jeando.
Hello, Kevin.
So we've been talking about Alexander's definition of the use of the self and how you interpret this and the difference between use as seen in the initial Alexander technique as you teach it and the modern Alexander technique as most people would learn it if they went to a teacher or read about it online. So we'll just over to you. So we've already done a couple of episodes on this and there's much more to talk about. And this will be a continuation of the last two videos. So if anyone's watching this, you want to check out the first two videos.
Exact. Yes, I think it's the subject is complex. The concept of use as defined by Alexander, of course, not defined as modern Alexander teachers think about it, is very, very interesting. And so there is more to say about it. And I've prepared some ideas about it. So going back onto the last part, we saw that according to experiments, that is, according to his experiments, Alexander established sort of an intimate relations between the functioning of the organ of speech and breathing and the relative position of all the parts of the torso. He found that it was what he later called a defect in the general use of himself, which were constantly lowering the standard of his general functioning and harmfully influencing the working of the whole organism. And that had consequences on his verbal capacity of maintaining a strong use of the voice as necessary for the stage. So I will display a quote on the screen, and you will see that the general use of the self results in a given posture or demeanor. So let's go and look at it. So what have we got? We've got a sentence also, but also there is a man. The picture shows a man. And well, some of you may know this is probably F.M. Alexander, because that picture is in fact shown in the first book of Alexander. And it shows a man, and this man is pretending to lift the arm above his shoulders. Yeah. And so before I read the quote that is coming from the last book, not the first book, but the last book, let's discuss the picture, because that picture represent what Alexander thought was an interference with the working of the organism in general. And we have here all the different misuses. We have the active shortening of the back. We have the protruding abdomen. We have, well, when I say protruding abdomen, you have to understand that what it means, because Alexander just says protruding abdomen in his, well, very particular way. But for me, protruding abdomen means that the abdomen is directed, the movement of the abdomen is directed forward of the front of the ankle, forward of the instep, but also forward of the head and forward of the upper part of the arm. This is Alexander protruding abdomen. We know that there is a tendency, Alexander pointed the finger to it, that when this happens, there is a tendency to, in fact, supinate the foot. That is, Alexander described this as having too much weight on the outside of the feet than it should have been. Okay? So Alexander discusses his findings in this quote. This is the quote that goes with that picture. And he says, these findings furnish again an analogy with observations that I made when dealing with my own problem. For I observed two things. I observed an interference with the working of specific parts of my organism concerned or connected with my throat trouble, the partial patterns. And second, I found that this interference was brought about by interference with the working of the organism in general, total pattern. This idea of partial pattern and total pattern are not Alexander's. Alexander's invited a scientist, and that scientist wrote an introduction to the Universal Constant in Living, the fourth book, where he described what he found with amblyostoma, with little animals that had a tendency to be directing the movement of the different parts according to a global pattern, and each special pattern was just a continuation of the condition set forth by the general pattern or the total pattern. Alexander, in fact, equate his theory with that of this scientist. It's quite interesting. So from that, if you follow Alexander, the interference with the working of the organism in general was not primarily what he was doing with the specific parts. His use of the specific part, that is how he directed the movement of the specific part, what he consented to do with the specific parts connected with this throat trouble. To be absolutely clear for modern Alexander teachers that are listening to us, the interference, according to him, was not what he was doing with the head and neck, or what he was doing with the jaw, with the lips, or the tongue. He said that this interference was the result of series of movement he was seen to do in the mirrors with all the parts which affected the relativity in the use of the head, neck, and all the parts of the torso with the limbs. And this is the continuation of the quote. And I am going to read the quote again, and I've got exactly the same picture attached to it, a man lifting the arms, what he's doing with himself when lifting the arms. And Alexander said that valuable as these findings were, the essential task still lay before me of learning two things. Learning first, how to prevent myself from continuing to do at a given moment what interfered with the working of mechanism as a whole, the total pattern of behavior, and what brought about a wrong working of the specific parts, what he called the partial pattern of behavior, which consisted abnormality. And secondly, learning how to bring about such change or such changes in my doing as would lead to a gradually improving working of the mechanisms as a whole, and finally to a normal working. So the concept of use that Alexander has developed is not about use as such. That is what you're seen doing with one part. I'm using my voice, I'm using my lips, I'm using my head, I'm using my neck and my shoulders, or the different parts of the torso. So not what you're seen doing with one part or another of the human mechanism, but it is about the general use defined a posteriori, afterwards, by the relativity in the use of all the different parts of the organism. What you can choose to do with the combined activity of the parts, which will affect the relativity between the positions of the part. When you're looking at the picture, you're looking at a posture. So we see the positions of the different parts. We see the position of the feet. We see the position of the pelvis. We see the position of the middle torso, and we see the position of the shoulders and of the upper part of the torso. We see these positions. Yeah. But you must understand that in Alexander's mind, this position and the position of the different parts, yes, are the result of combined movements of these parts. The person, without knowing it, or in that case, if it's Alexander, knowing exactly what he's doing, is directing the movements of the parts. That way, we describe two possibilities. The direction of the movements of the parts can be habitual without knowing. The person is not knowing that he's pulling the calf backward in order to push the lower torso and the pelvis so far forward, or the person knows very well what he's doing and is really pushing the calf back as a voluntary act, as the act of pulling the shoulders back is a voluntary act, and as the act of pushing the lower rib cage and pelvis forward is a voluntary act. So you have two possibilities. Use can be either engineered, constructed, reasoned out, or use is just habitual and following what the person feels as being right. And the person may just think of lifting the arms. And just that one order is going to create a whole series of movements of the different parts combined together. And this coordination of movement is going to, well, create what Alexander called the interference. So it's a very important step in understanding what is the initial Alexander technique. That is, we are clearly discussing the relativity between the parts. So it's impossible to stretch enough the importance of the concept of reasoned relativity in the use of all the parts. I don't know how to say it, but reason, relativity holds a tremendous importance as it is directly connected with the central idea of the guidance and control of the primary control of the general use of the self. This reason relativity is obtained by directing a series of concerted or combined movements together. So you have the habitual relativity resulting from the movement of all the parts in a particular activity, like lifting the arm. And this use is subconscious, automatic, and just adjusted to the feeling of rightness that the person has assimilated. By repeating habitual movements, they become second nature. And not only second nature, but they feel as right. Yeah. And so when I observe a teacher of the modern Alexander technique, the teacher wants to have a lesson. The first thing is to think, okay, I haven't asked to that person yet to lift the arm, but I will. In a moment, I will ask the person to lift the arms. But already, it's possible to see what is the habitual movements and what are the relative positions of the parts. And this is not an example of reason relativity in the use of the part. Yet, I well know that reason relativity in the use of the part, in the use of all the parts, all the bony parts of the mechanisms, is a human capacity. And that human capacity has to be constructed by reasoning out the speech instructions, the orders, which can allow that person to make decisions altogether, to make decisions to do simultaneous movements and control. Next, after watching the video, that this combined movement results in a correct expanding torso, a correct relative position of all the parts. So we have the picture, and we think, okay, there is a tendency for the lower rib cage to be very far forward of the upper rib cage. At the same time, we see that the lower end of the torso, the lower part of the torso, the pelvic bone I have at the back, the sacrum bone. I can ask the person to wear a stick on that sacrum bone, and the person will see the direction of that line. And we can immediately infer what are the movement the person has, in fact, given consent to in order to obtain that kind of relativity between the parts. So that's the third point. We note that the relativity we are talking about is a relativity in the use of their parts, head, neck, parts of the torso, and other parts. We are not discussing a natural directions of movement. We are clearly discussing a reason one, which means that language is impossible to separate from the process of obtaining the new direction of general use. I do not dream any second that a person could, through nice hands-on work, get some sort of understanding of the concept of general use. It's quite interesting that the person is, of course, a teacher of the modern Alexander technique, and apparently a 3 years training course with hands-on every single day has not changed the pattern of the reaction of that person to the stimulus of standing. We can see that the lower, rib cage and the front of the abdomen are way forward of the head and the feet. We can see that the back of the person is shortened. So now we are clear about the definitions, so that we can say that there are words that Alexander is using, for example, using the parts. So for him, that means what the person does with the movements of the parts. How we bring these movements into play in a particular combination. I am very careful in the wording of these sentences because there is a massive difficulty in Alexander's books. Alexander does not speak like that. He does not question what the person does with the movements of the parts. He questions what the person does with the parts. How we bring the parts into play in a particular combination. I consider that this is a dreadful way of expression, and it will drive many students to try and work with the part. When we are clear that we are asking the person to take responsibility in the direction of the movements of the parts. So when we say, how do you bring into play movements in a particular combination, then we diffuse the magic, we annihilate the magic, if you want. What we are discussing is really objective. So objectively, in practice, that amounts to saying how the parts are seen moving in a mirror or are seen moving on a video recording relatively to one another to form a particular posture. So to an objective observer, the use of the part is the combined movements of the parts that the subject is seen doing in front of the mirror on video recording. Well, that, of course, is provided the observer is capable of discerning these movements of the parts when they occur under their eyes. And that is not a given. At first, after my training as a touch teacher, my STAT training, I was trained to feel with my hands, to feel many things, supposedly to feel even what people don't see. Well, it didn't help me to see at all. because that's for sure that people didn't see. I noticed I was not capable of seeing movements occurring at the same time. And so that was a very difficult moment. So to come back to the general idea, we have a question of principle, the principle. So for FM Alexander, the concept of use of a part is subordinated to the concept of general use. That is, movement of the head and neck is dependent of the combined use of all the parts. So the movement you will see at the head and neck depends on the capacity of the person to support the head and neck. And that support can only come from the combined use of all the parts that are not the neck and head. And so we start to observe now what is happening. You have a student, and the student is told a story of orders that could be given when the hands are lifted. So this student is now told that it could be possible to direct a movement of the sole of the feet. Of course, you can command a movement of the sole of the feet forward while the feet are resting on the floor, and there is a friction, and you can activate the movement. It's the movement of extension of the hips, knees, and ankle. When you direct the feet forward, the knees are moving back, and the hips and potentially the pubic bone are going back. This is what I request from the pupil to have in mind before reacting to the decision of lifting the arm. What are you doing with yourself when you lift the arm? Well, here it's obvious that the person is requested to lift both arms, one ending on the side of the jaw, the other one ending on the front of the lower rib cage. What is that person doing when lifting the hands? And so we will find that this is a representation of the door exercise. Some people thought that the door exercise was to get to impress upon the brain the correct alignment. You know why people are lying down on the floor, on tables in the habitual Alexander technique, the resting crouch or the semi-supine, it's called, it's got many names. And it was thought that this was similar, that the idea of the door exercise is to align the parts. Well, on this picture, what you will discover is, in fact, that the person is reacting to the movement of lifting the arms by a series of movements of different parts. And this series of movements of different parts has the tendency to lengthen the back and to get the middle back and the upper torso forward, so that the head starts to come forward of the lower rib cage. And also, added bonus is that it's not the wall that is, in fact, drilling a shape into the mind of the person. No. The person is lengthening long before touching the wall. The wall is just conscious control. It's not part of the directions of the movement. You're not directing the movement because you're sliding up and down along the wall. You're directing the movements when you know that your habitual use has a tendency to show different movements of the parts, and that by a conscious reaction to the idea of lifting the arm, then you are seen to be, in fact, in contact with the whole wall, so that it means that the lower spine, the lumbar region has lengthened, and that the head has gone forward and up. So it's a different mindset. We don't want to have a feeling of what it is to, as most people say, be aligned on a table, aligned on a wall. No. We want to be capable of directing the movements which are going to create the lengthening and widening of the back, that is to create the lengthening of the neck and the direction forward and off of the head, as seen on a video recording. So we have a proof that the person starts to be able to react to the habit of lifting the hand. You would not imagine how a person reacts. And even if you have been trained, even if you had years of training with the best teachers of the modern Alexander technique or any somatic technique, it's never going to replace conscious guidance and control. And as soon, that is another point that is very interesting, is that it's not because you've been able once to use these stories and these different series of orders in order to obtain the lengthening of the back that suddenly it's a second nature. As soon as you ask the person to go and take a walk and come back standing in front of the chair, you will find, well, the same old pattern of movements. Immediately, the person is seen back into the habitual combination that results in the relativity in the part that we call an interference with the general use of the self. Yes, but the person can quickly, every time the person is going to now lift the hands, we are going to see what the person does with herself when lifting the hands. And I can tell you that that person is reacting to the idea of lifting the little fingers toward the wall in a manner that is reminiscent, that is clearly the same. Well, minus a bit of difficulty in getting the movement to obtain at the lower rib cage, but more or less we see that the person is using conscious directions of movement and conscious inhibition of movements. On this picture, what you see, well, it's like a Christmas tree. There are bulbs and lights and arrows everywhere. What we see, the person has first, well, found out by palpation where the front of the lower rib cage was. So the green line, horizontal line that you see is the front of the lower rib cage. Now, the grid is passing through the front of the instep, and I have put the grid afterwards, of course. The person is not, cannot, well, use that grid at the moment of performing the actions. Or what we say that the person can use an intellectual. The person can pretend there is a grid, as well as the person can pretend that there is an horizontal line at the lower front of the rib cage. And this will help the person organize a reaction. What are the different movements the person is doing is indicated by the different arrows. We see, of course, that there is a movement for the lower rib cage and the pubic bone to go back. This is certainly the reaction to the direction of movement of the feet forward. And what we can see is that the person has been asked two different stories, to have two different stories in mind, if you want, apart from this movement along the middle line of the rib cage. And so what are the stories? One story is to conceive a center of rotation for the rib cage. You can say, when I'm going to move the hands, I want to keep something in mind, is that there is the front of the internal part of the arm at the height of the armpit. At the height of the armpit, you can touch the front of the arm and you can touch the back of the arm. So you have two spots now that are conceived, that are created out of nothing. They are not something you are supposed to feel. They are something you are supposed to use in order to, in fact, precise and define your decisions. So the decisions here is clearly to go forward when the hands are going forward, faster with the back of the internal part of the arm than with the front. There is an inhibition of the movement of the front. It's not that we want to absolutely maintain the front of the internal part of the arm in place, but in our head, there is clearly a proportion of movement where we want the back of the internal part of the arm always to go forward faster than the front when the lower rib cage and the pubic bone are going back. And using these movements, well, it's obvious that the person is starting to react to the movement of the arm by a series of other movements that are in fact lengthening and widening the back, that are getting the abdomen further back. And as we can see, there are two spots that are marked. It's another story we have told the pupil to keep in mind. So different parts of stories can be made into a greater story. And that's the idea. And here, the point is to imagine that it could be possible to direct the top of the shoulder, we call the top of the shoulder spot, and it's easy to locate. It's the top of the acromion. The acromion is the extremity of a ridge that is part of the shoulder blade. And so I ask the person to touch that ridge, to touch the extremity of the ridge, and I say, when you get to the extremity of the ridge, let's call that spot, that's the size of the tip of the index, let's call that spot, well, the top of the shoulder spot. As well, you can ask a person to palpate the side of the jaw. So at the front, we have the chin, and that bone is going right toward the ear, but there is a sharp bend. And at the position of the sharp bend, I ask the person to, again, name that spot. We call that spot the mandibular angle, because the mandible is the bone of the jaw, of the lower jaw. And so I'm asking the person whether it could be possible, when lifting the hand, to make the decision of movement, to direct the movement of the top of the shoulder spot away outwards from the mandibular angle. Could it be possible to imagine lifting the hand and lengthening the distance between the top of the shoulder spot and the mandibular angle? Well, at first, this defied the habitual reaction, because at first you will find that every time a person reacts to the idea of lifting the hand or lifting the arm, the person does something. The person lifts the shoulders, and the shoulders are lifted toward the head. So the distance between the mandibular angle and the top of the shoulders is shortened, and there is a tendency for the back to narrow. So in that case, the person is reacting by, you see, look at the shoulders. They are nearly, the hands are going up, but the shoulders are not. But what we can see, that the hands are going forward, but the back is going back. And the head is starting to come relatively to the lower rib cage forward. So we discuss these movements in a fairly static system. And from the static system, it's also possible to change the habitual direction of the general use in dynamic. So here, as you can see, the person is again directing an inhibition of the movement of the front of the internal part of the arm, directing a movement of the back of the internal part of the arm forward, so that when she's bending, if you look at the position of the back of the internal part of the arm, you will find that it stays in place. And even when the person is moving, we see that the person is moving, well, more or less in a geometrical fashion. The back of the internal part of the arm is, in fact, well, saying on a vertical that the person cannot see nor cannot feel. So the person is starting to be directed by intellectual concept of geometry. This is a demonstration of conscious guidance and control. So the problem which FM Alexander is placing in front of us is a question of how to change the habitual direction of the general use of the self. So you have a general use of the self, and replace inharmonic actions, a combination of action that result in a lack of harmony, lack of lengthening, lack of expansion. And what we want to replace is a direction of movement that depends upon feeling. That's what the person is doing. That's how she feels to stand. And so we ask her, instead of feeling how to stand or feeling how to get a light movement of the arm, we're saying, no, you're going to change your reaction when you are seen lifting the arms. And so we want to see whether you're able to direct a series of movement at the same time, so that the whole, relativity between the position of the part is changing. And so we want to replace the old pattern, and we want to replace the automatic direction of the self by reason combined movements of the bony parts, which allow to perform any specific movement as an extension of an expanding torso. It's like the expanding torso. So there are, I'm showing different pictures of the person going into some sort of, well, working position or sitting if you want. And there are things that are not absolutely correct, that's for sure. But we have now a question to ask. We have a question to ask, for example, that when the person is going forward with the upper torso, neck, and head, at the moment we see that the pattern of movement of the head is such that the neck, well, going forward, has a tendency to be associated with the chin going faster forward than the mandibular angle. So we could ask the person to note this habitual use of the part that is associated now with, well, a relatively interesting widening and lengthening of the back, but we could ask the person to question that. So could it be possible to tell a new story? To come forward faster with the mandibular angle than with the chin? The person is not making an effort to go forward. The going forward is the result of the rotation of the upper torso. So if the upper torso is moving in the way we are seeing here, with the lower rib cage going back relatively to a proportion of a fixed axis of rotation at the front of the armpit, we see that the upper torso is coming forward, and with it, obviously, because the upper torso is in fact generated by the direction of the upper spine, of the thoracic upper spine, we see that the cervical spine is going forward, and as a result, the head is going forward. Now, when that is happening, could it be possible not to get one spot faster forward than another one? And the person will start to discuss, oh, yes, it's happening all the time. I'm always going forward, but forward with the chin. Why not go forward faster with the mandibular angle? And what would be the result in the rotation of the head? We see clearly that the head is rotating back and down instead of going up along the back direction. So again, a new kind of questions that are arising. So that's introduce the second part of my talk. So it's possible maybe to stop here and start again. Or just to continue with the second part. The second part is about of course, that question that Alexander was asking, the knowledge of how to direct the general use of the self, how to direct the general use of the self.
Could you talk a little bit more about the why it's important to talk about the movements of the parts rather than just the parts? So, like, one thing that came to mind for me was, as soon as if you think parts, you're immediately pulled into feeling the part. It's almost like automatic if you start thinking about or feeling what you think is that part. You know, if you say knee,
yeah.
First of all, knee's quite vague. Which, you know, where, what exactly do you mean by knee when someone says knee, especially if you're doing things?
Yeah.
And then you immediately just start feeling whatever sensations are in the vaguely the general knee area. And then you start trying to manipulate those sensations, which are old feelings that you're used to. And anyway, it's the wrong tool for the job. So I was wondering if you could talk a little bit more about that.
Well, that's what you said is exactly correct. This is the main problem. If you are starting to direct parts or to, want to drive your attention on parts, you're bound to feel the parts or feel what you think the part is. How do you delimitate the knee or the elbow or even the head, for example? It's absolutely unclear, untechnical. Technique is just using principles and using reasonings, which means using words, using speech, in order to obtain a construction. Well, if you start directing parts, you're going to feel the part. So the massive erroneous idea would be to say, there is too much tension in the part if you see a lack of movement.
Yeah, it's
But
also a
if you try,
judgment. They're making a judgment. They're saying, "Oh, this part's your neck is too tense." They say that they're saying that, which actually it's better to say your head when you're doing these series of movements, your head isn't going far enough forward and up. So that like it's better to say that the movements aren't what you're looking, relative to the lower back or however you're defining it with the person. So it's
exactly.
better to talk about the movements rather than because tension it's already a judgment. You're saying it's too tense rather than just observing the phenomena you can see in front of you. And Alexander's quite visual in his early books. You can tell it's something he's looking at when he's working with someone. It's not simply feeling them, and them feeling his hands. Um, so yeah, so can you talk about that?
Yeah, there is well, Alexander, you really talked about it, and the problem with discussing parts and coordinating parts is that you're going to. It's so easy to isolate the parts when you think a part. You think, okay, I've got the neck is too tense. The neck is not free. Yeah. Well, then you isolate the neck. And then the fundamental principle of relativity between the movements of the parts totally disappear. What is different is that when you release one part, suddenly your mind is miles away from the relative position of the parts. And when you say relative position of the parts, it's a difficulty that I found on every page with Alexander. I always have to translate what he's saying, because instead of saying there is a protruding abdomen, there is a shortened back, which are in fact describing parts as if they were isolated from anything. If you discuss the position of or as a result of the movement, well, then it's a movement of something relatively to something else. Then it's impossible to say that you have to release for the abdomen to go back. Then you have to understand that you have to direct movement, and that the movement that are actually directed are directed so that the abdomen or lower rib cage is going forward relatively to the front of the ankle and relatively to the top of the torso. In that case, you're starting to think in relations instead
this
of
isn't something you
magical
can do.
thinking.
Yeah,
Yeah.
you can't do this with feelings and sensations. I mean, the person, maybe a modern Alexander person or somebody in somatic therapies, might think, yeah, but once you educate and you get it back in your body and you can feel your body better, you'll be able to all this the relations between the parts. You'll be able to feel more and more things at once, and you'll know where things are. But that isn't what happens. You have to, in order
Yes,
to
but that is
understand,
objectively not true. It's
just
very,
from a
very
practical
simple
point.
to create an experiment where we film the person and where you ask the very simple action of lifting an arm, or well, a more complex action. You ask the person to go up on the toes or to sit on the chair, and immediately it's absolutely obvious that the person has no idea how the movements are relating to one another, and that there are movements that happen in the structure the person has no idea that are happening, despite years and years of somatic. That well, prompt me in the past to search another way. There must be something I missed. In first, I missed because my teachers never told about it, and also I missed in the books. Should be somewhere in the books.
It's
So
almost like
we will
a
see.
cognitive error, or almost because the person's like if they're thinking that well, it's not really thinking. If they're assuming that they can feel a system of relations between things, when really you can't sense it. You have to understand it. You use your senses to get the information. For us, we're looking at watching a video. So, like to bring video to the work, you immediately opens up another realm of things that you can understand and you can reason about and you can make new decisions. You just can't do if you're trying to feel, and even practically try and feel more than 3, 4 different body areas of the body at one time. You just can't do it. You just technically you don't do it at all. You just jump from one to another very quickly. But you
Well, yeah,
you
and
can kind of get them together. But how are you going to? There's way more parts to be moving around in relation to one another. It's just not. It's just simply not possible.
I want to make a comment on this. It's so that we have better words to address this position, this intellectual perspective. Is that when we make a movement, like sitting, for example, we don't want to feel the parts or the status of the parts. It's much more simpler than this. We want to see the position of these parts relatively to the others. And we have no sensory mechanism that can, in fact, reliably inform us about the position of the parts in time when we are going to sit. When we go to sit, well, either you have a subconscious direction of the self, so you don't know, or you have seen many videos where you were looking at your habits and then deciding to take control of these habits by directing the movement consciously together, so that in the end, you start to become more or less clear about what are the movements you need to make decisions about and to follow these orders, obey these orders in activity to obtain the particular relativity. At one point, you get a mathematical precision. It's not that difficult, but it's a different realm. We are not speaking about what you feel. We are just discussing concepts of geometrical use, so that you can have not a feeling of the position of the parts, but a clear idea of what you are doing. What are the different doing that are combined in order to obtain the result, the geometry that you are interested, and how to inhibit the position you don't want to relate together.
Yeah, we're more interested in what we're doing and doing things in a different way rather than just sitting around deciding how we feel about what we just did.
So directing the parts is, to my point of view, is a tremendous danger. If you start to think in these ways, you're bent to be drawn toward the somatic technique. If you think about directing the movements of the parts and observing, well, the movements of the parts and starting to describe the movements of the parts, you're freeing yourself from this sensory dependence. And the problem is that the sensory dependence, to all the experiments I've made with different teachers and different somatic superior people, is that it does not help to get the direction of the expansion of the torso as promised. It's not working. Technically, it's not.
I've done this with so many different types of people who are complete experts and way, way more advanced and skillful than me in basically in every kind of sphere of life at some point. And everyone does the same things, including myself. It's just part of the human condition, and everyone has their own way of doing it. And you're just learning to use your, as Alexander would say, psychophysical mechanisms in a different way than the habitual way. Okay, thanks, Jeando. So are you, if you're interested in booking a lesson with Jeando, you can go underneath and there's a link to his Facebook and his email and his website. And we'll see you in the next video. Thanks, Jeando.
I will quickly book a lesson with myself.
Yes.
Thank you.
Okay, bye.
Okay, thank you, Kevin.
Okay,
bye.
You're welcome.